Happy Monday. Happy Monday. It's time for Monday motivation across the nation. This is also how to pass NCLEX. And today we're talking about post-operative care, specifically in nursing. But before we get into the NCLEX topic, let me just tell you that this is an amazing new week because you were waiting for this to happen. And I've been getting the messages and I've been seeing the comments. Remar, tell me, Remar, when are you going to have a sale? When is the next sale? People have been asking me this since back to school in September. So I want to let you know that the sale is on right now for the NCLEX V2. We have our Scary Topics event that we'll be launching on tonight. So the sale for the V2 is on. That means you're going to get the V2 platform, the V2 books, the V2 Q Bank. You get 3 months for the price of 1 month right now. So if you go to remarnurse.com, you can sign up for your V2, finally get started on it, because this is the perfect and acceptable day to make your journey to passing NCLEX get started now. So also what I want to say is, again, if you have not signed up for Scary Topics, is dropping tonight, part 1, 8 p.m. Eastern Standard Time. Convert that to your time zone. And then part 2, this is a 2-part series. Very rarely do I do 2 days back to back, but Scary Topics is one of those. It's such a fun event because we're really going to look at the topics that nursing students are afraid of. If you signed up by going to remarnurse.com/scary, then you have the workbook. You have it in your hands. If you don't have it, it's not too late to get it. So again, this is a very happy Monday. This is a very happy Monday because as I was touring the different cities here in Kenya, I was just understanding that when you have the platform, when you have the V2, when you have direction, then any barriers that are in front of you to get your license, they go away. There were so many nurses here that came up and was like, hey, I've already passed NCLEX. I passed it. When you came back in March, I made the decision. And now in October, I have my USRN. So it's really that simple, because when you get to a place where you're like, I'm not going back to where I was, I want something new, I want something different, I'm tired of talking about it, I'm tired of waiting around for the right time. No, the right time is now. The right time is now. So we are on this mission to connect people with power. Okay. Also, we're going to be talking about post-operative care. So let's get into it. Post-operative care is a very specific time frame of nursing. So actually, the beginning of post-op care is when surgery has ended and the client is going to continue in recovery. Now, people who are going to do surgical nursing, you may be in the OR or you may be in the PACU. Okay. And PACU stands for Post Anesthesia Care Unit. Okay. And so this is a location that patients go to recover. Now, the standard of care when it comes to nursing care, it does not change depending on the location of the patient. So the same great care that the patient got in pre-op, in the operating room, in post-op, in med-surg, in rehab, it all should be the same. But I'm focusing on this particular topic because for NCLEX, what I find is the priorities of the PACU, okay? The priorities of the PACU are a higher or advanced conversation. So when we talk about a patient who has had surgery, let's say this, let me just give it a try. If a patient had abdominal surgery, would we prioritize a sore throat or would we prioritize decreased pulses? If a patient had abdominal surgery and they said, nurse, my throat is hurting me, my throat is sore, or if you notice decreased pulses, which one would be your priority that you would call the doctor about? This is post-operative NCLEX question, okay? The priority. So I see the comments on the screen. The priority would be decreased pulses. It would be those decreased pulses. That's the priority, because what would we be expecting? You got to think about what's expected, what's not expected. If a patient had abdominal surgery and they said, oh, my throat is sore, I am expecting that to be normal because of what? What would cause the patient to have sore throat? They were given general anesthesia. They may have been on a ventilator, mechanical ventilation while they were sedated. You're going to have a sore throat from that. Okay. But I do not expect you to have decreased pedal pulses. And so I'm going over this so that we are understanding, number one, just our basics of normals versus abnormals. But when we layer them into a patient scenario, you still have to have that fundamentals. You have to have that fundamental training in nursing. So that's what we'll be doing today. Reviewing again post-operative care. And so the care provided post-operatively as the client is recovering from surgery and also more than likely anesthesia. So you have to remember the how anesthesia changes the body hemodynamically. The surgery procedure also, we know, provides trauma to the patient's body, and it disrupts protective mechanisms and homeostasis. And anesthesia impairs the ability of the client to respond to environmental stimuli. So post-operative care, if you are going more in depth into it, maybe if you're taking a nurse practitioner exam or if you're taking a surgical specialty exam, you will need to know the phases 1, 2, and 3. This is typically when you understand the patient ratio of the nurse during the specific phases. So when a patient first comes back from the OR, they're usually a 1-to-1. They have one nurse that is monitoring them, doing vital signs every 5 minutes. Or maybe the nurse is 1-to-2, but we understand that the patient is extremely critical. Also, if you're going to do an OR specialty or PACU specialty, then you know certain things, like there's certain adults that are always going to be a 1-to-1. If you're working in pediatrics, any child under the age of, I think 10, it could be 8. I'm not sure. I think it's 10 or 8. They're always a 1-to-1, especially if they've had general anesthesia. So those are the more fine details of the PACU and the phases post anesthesia. We don't have to worry about that for NCLEX though. We do understand that also there's a clinical component for patients that may move from the PACU to inpatient care. And then there's also principles of home care, which I will discuss. And so one of the things about the admission to the PACU, Post Anesthesia Care Unit, is the endorsement or report. In the US, I think we call it more commonly report. And in other countries, I think it's an endorsement. But anyways, it is the notes about that patient. It is the important factors about that patient, the anesthesia report, the circulating nurse who was in the OR. What did they see? What did they experience? Those are all things that will allow you to monitor your patient if you choose to either work in the PACU or if you're taking NCLEX. These are the things that we need to be mindful of. Airway, the patient's cardiovascular status, because what is a problem after surgery? Circulatory collapse, circulatory decline. So we're looking at the patient's skin color, fluid status, level of consciousness. If a patient has had anesthesia, they may need some time to regain their mentation. They may wake up confused, right? We're not allowing these patients to get out of bed alone. We are being very aware of their safety, okay? Reflexes, you have to know the different reflexes. You have to know the activity, the operative site, monitoring that. Discomfort, safety. And so again, these are all things that I am saying in a review scenario. But the whole goal is that when you take NCLEX, you're not just focused on one part. And that's a mistake that a lot of nursing students make, is that they say, well, I'm only going to study my weaknesses, or nurses coming in, they're international trained nurses, you have to understand NCLEX is a general exam. So that means you have to know about surgery. You have to know about pediatrics. You have to know about maternity. And so the resources that I give you, quick facts for NCLEX, that is going to cover most of your acute disease processes, whether it's pediatrics or geriatrics. The V2 workbook, I'm telling you to go and watch those lectures, because in order for you to have a general knowledge, you need to have a general review. Okay? Don't get in the weeds. Don't get in the minutia of reading a large med surg book. It's not going to help you. It's not going to help you. All right. You're trying to do this as efficiently as possible, learning this general information. And so the client who is going to a clinical nursing unit, they're being discharged from the Post Anesthesia Care Unit. There are certain things that you want to give in your endorsement. The operation that was performed, the presence and location of any drains. Also, the anesthesia that was used is very important. Anesthesia has side effects. Post-operative diagnosis, how much blood the patient lost, and the meds that were given in the PACU, namely pain meds, nausea meds, right? Fluids. All right. And so when you're in a clinical post-operative care, we're going to look at the initial assessment. What's the diet the patient is on? IV fluids and medication, their position in bed. Are they high Fowlers, semi-Fowlers? Medications the doctor wants to administer, laboratory values that the patient is going to need to have. Most patients coming back, the doctor's going to want to know their hemoglobin, their hematocrit, all right, a CMP, complete metabolic panel, and the activity that they are permitted to do. Nurses, what are we monitoring? We're going to monitor the level of consciousness, the vital signs, the skin color, comfort, fluids, dressing, drains, and tubes. So this is part of our evaluation, because this evaluation, what it's going to do is it's going to help us to anticipate the clinical emergencies. And even when our patient's getting ready to be discharged, registered nurses, we do discharge teaching. It should include maintaining comfort, how to promote healing, restoring wellness, okay, appropriate community agencies to assist, and or referrals. And this is part of seeing the patient as more than just a diagnosis. We really want to support the patient. So, as we are preparing to be nurses, we know that taking the NCLEX is about public safety. We know that it is about public safety, and I'm looking for you to be a safe nurse. The only way I can determine that is if you have studied the content in the V2. Also, the question bank that is in V2 has over 2,000 questions that are also going to help you to evaluate yourself. Read those case studies. Don't be afraid of them. The case studies in the V2, I promise you, they're more challenging than the ones you're probably going to get on NCLEX. And that's part of the training. That's part of the training. Okay, well, you know what? It's time for us to do our NCLEX questions. Here's the first one coming at you right now. We're dealing with post-operative care nursing. Okay, question number 1. A nurse is providing care for a client 24 hours after abdominal surgery. Which assessment finding would most likely indicate the development of a post-operative complication? Number 1, mild abdominal discomfort. 2, urine output of 40 milliliters per hour. 3, redness and swelling around the incision site. Or 4, fever of 101.8. We are talking 24 hours after an abdominal surgery. Which one of these are going to send off your nursing antenna, like my patient may be in trouble, okay? I hope you said this very obvious one. It's the fever. It's number 4. We're talking about 24 hours after the surgery, not immediately after. So make sure that you're looking for those small details in the question that will put you on to the right answer. That is going to be the one that may indicate that there's some infection process going on. All right. Most of the other things were expected in terms of our patient. So let's move on. Question number 2 coming at you. Oh, this one's so good. A nurse is caring for a post-operative client who just returned from surgery. Which of the following actions should the nurse prioritize in the immediate post-operative period? Number 1, check the client's blood pressure and compare it with preoperative values. 2, monitor the client's surgical dressing for signs of excessive bleeding. 3, assess the client's level of consciousness and orientation to time and place. 4, review the client's intake and output to ensure adequate kidney function. So good. Correct answer 2. 2. Sorry, guys. That I jumped that off too quickly. It is 2 though. Monitor the client's surgical dressing for excessive signs of bleeding. Okay, this is going to be the priority over 1 and over 3. Okay, why is that? Because you're going to be able to determine more quickly. And I know some people pick 3. You're going to be able to determine more quickly if a patient's in trouble by just looking at that surgical site. And if it's excessively bleeding, that will be a quicker indication than looking for a change in the level of consciousness. So one of the things we have to understand is that NCLEX is not asking us what's the right answer. It's asking us what's the priority. Okay. All right. Here's question number 3. A nurse is educating a client on deep breathing and coughing exercises after surgery. Why are these exercises important for the post-operative client? Number 1, they help to prevent blood clots. 2, they reduce post-operative pain. 3, they prevent pulmonary complications such as pneumonia. Or 4, they promote early bowel functions. So we're talking about coughing and deep breathing. This is a very good safety point. Correct answer is going to be 3. They prevent pulmonary complications such as pneumonia. And you guys know the benefits of coughing and deep breathing to clear secretions. 4, this is also a great one. Which of the following interventions should the nurse implement most to prevent deep vein thrombosis in a post-operative client? Number 1, apply a warm compress to the lower extremities. 2, encourage the client to sit still to avoid pain. 3, administer prescribed anticoagulants as ordered. Or 4, encourage the client to increase their fluid intake. Again, some of these are right, but what is your priority here? This is a great safety question. We're going to do number 3, administer those prescribed anticoagulants as ordered. Now, we know that walking, anticoagulants, they promote circulation. Also, increasing fluid intake will help. But when we talk about anticoagulants or increasing fluid intake, which is going to be the most effective, all right? Which is going to be the best, which is going to be the priority. And that is going to be number 3, the anticoagulants, okay? So as you can see, when we talk about post-operative nursing, the idea is being able to anticipate the challenges of somebody who has had trauma to their body, okay? So it's so important that we're able to do that. All right, I hope that you enjoyed post-operative nursing review. Now it's time for our Monday motivation across the nations. Just because you carry it well doesn't mean it's not heavy. And there are many of us today, you look better than what you're going through. And when I meet you, I see these beautiful smiling faces, but then you pull me aside and you say, Professor Regina, I have this going on. I'm stuck between a rock and a hard place, and my life is extremely difficult right now. My life is extremely challenging right now. So, what we like to do on Mondays is we like to have a focused scripture that will carry us through the week. And that scripture this week, do you guys have one in mind that's good for when you're feeling the heaviness of life, when you're feeling like, I got this mountain to climb? Let me give you this one. Matthew 11:28 and 30. Come to me, all who are weary and burdened, and I will give you rest. Take my yoke upon you and learn from me, for I am gentle and humble in heart, and you will find rest for your souls. For my yoke is easy and my burden is light. Oh, when Jesus said that, I swear he was talking to nurses, because nurses, you know, we have to carry the load of others. It's our job. We have to take on the burdens of strangers, family members, anyone who comes under our circle of influence or care. And when people meet us in our jobs, they are not at their best. They are oftentimes very weak, whether it's mentally or physically. So we get into just a habit of carrying heavy loads. We have to remember this scripture, because if we are in a mentality that we are doing it all alone, our strength will fail us. We will fall into periods of sadness, periods of depression, when we feel like we are all alone. So I thank God for this scripture, because Jesus is reminding us that he is there. And actually, what he's talking about his yoke. And I seen this in Kenya. There were two animals that were yoked together. A yoke is a farming implement that joins two animals, such as oxen, and they join them together so that the animals can share the workload evenly and become more productive. In nursing, you learn to carry a heavy burden. However, Jesus is right there to help you carry the load. So Jesus says, take upon my yoke. It's light. And that's because when you put on the yoke with Jesus, you know he's doing most of the work, and you are the smaller of the animal. Actually, you are the runt of the entire bunch. You know, when the puppies have a lot of babies, and then the runt is like the smallest one, like the cutest littlest one is not as big as the others. That's you. That's me. We're not. Jesus is going to be carrying us. So it's such a good scripture to remember for this week. Not everything that weighs you down is yours to carry. These are the takeaways. Jesus isn't hard. He has made himself available to us. I hope you see him through the help that he sends you. No matter how small your burdens might be or how big they might be, you do not have to go through it alone, because Jesus is willing to become your partner in every step of your life. And so I just thank God for the scripture, him saying, I'm going to do this thing for you. How many people need him to do something for you this week? Also, I thank God for the people that he will send your way to encourage you, to help you carry the burden, to help you carry the yoke, to help you carry the grief, the sadness, and all of the feelings that we feel as we go through Monday. I don't even have to talk about Tuesday and Wednesday, but just Monday as we just go through this day. So I just appreciate, again, our community. I appreciate what we're doing, the people that I'm meeting, and all of you who are encouraging one another to keep the good fight of faith. I'm excited for our community events we got coming up. Scary Topics is tonight. I will see you all then. Also, we have Winning Wednesday. Don't forget, All right. So 2 parts. So actually, listen to this. Look at the help we'll be having Monday, Tuesday, and Wednesday. We're going to be together this week. So let's get into it. This is the season of finishing. We're finishing the year strong. As always, you can, you will, and you must pass NCLEX. See you tonight.